Just wanted to talk you through some of the things that you can think about when you've got an Achilles injury. This is one of the most common running injuries that we see. So 80% of runners are injured at some time during the year, and about 10% of those are Achilles problems. So one of the things that you have to sort of be aware of is how extreme is the injury. Is it just a light tendonitis? A little bit of inflammation? Is it in the beginning stages of being a problem? Then you can really take some action and do a whole lot of stuff to help yourself before it gets worse. Or is it ruptured? So if you've heard a big crack, and it's usually happened during an accident where you've fallen over or something like that, and you've heard a big crack and you've actually ripped it, then you've probably ripped it off the bone, or you've partially ripped it, and that's a much more serious problem that you shouldn't be exercising too soon after such an event. However, if you've just got inflammation, and you can usually tell sometimes heel injuries can disguise themselves as well. So you need to sort of differentiate between, is it an Achilles injury or is it a heel injury? And if you just feel along the line of the Achilles and you feel it's painful as you go up, then it is the Achilles and not the heel, okay, for diagnosis purposes. So a few things that you can do. Obviously, the rest, ice, compression, elevation thing in the acute phase is very important. Taking turmeric is a fantastic anti-inflammatory, a natural anti-inflammatory. I'm not a big fan of non-steroidal anti-inflammatories if you can avoid them. Obviously, if it's an acute injury, you might need to do that temporarily, but it has other negative effects on the body, so you want to avoid that. So turmeric is a very good thing to be taking. Helps with inflammation right throughout the whole system anyway. As far as how to deal with tendonitis, now, if this is a recurring injury that you seem to have a problem with again and again and again, then it's very likely that you've got a running technique problem. You're very likely overstriding, meaning that you are landing ahead of your foot is landing ahead of your body when it should be landing directly underneath your body. You may be landing on your forefoot ahead of your body, and that's putting a massive load on your Achilles. Another thing that we see is the heel not touching the ground. You're bouncing on your toes. Some people like to run on their tippy toes, which, yeah, it looks good and it makes you feel like you're running lighter, but it puts that whole pressure on the Achilles, and really it should be kissing the ground so that you're stopping that pressure momentarily, because when you do that a million times, of course, the inflammation can get really, really bad. So a couple of things that we really recommend that you do, and this is just generally good practice anyway. We have one of the products in our shop is called like a mini foam roller from Black Roll. And this is just a little mini foam roller, literally that sort of big. And this is a great tool to be able to roll out your feet. So you need to be working on your feet and your calf muscles, so above and below where the injury is. So you can be doing rolling out, stretching with the feet, lots of stretching exercises where you're really mobilizing the whole foot, the whole ankle, and doing this on an absolutely daily basis. This is the important thing. Like doing this once and then thinking, oh, well, it didn't work, it's not gonna make any difference. You have to be doing this daily for at least 4 to 6 weeks to really get on top of it and make sure that it doesn't come back. So rolling, stretching it out. You can also use something like a cricket ball if you don't want to buy one of these mini foam rollers. A cricket ball or a softball or something like that. A little bit harder than a tennis ball is not usually hard enough to get right in there and to massage and stretch and mobilize that whole foot area. Same goes above the Achilles, so into your calf complex. You want to be rolling on a foam roller, or even better, a broomstick. Get a broomstick and sit on it, and it's a bit hard to explain on the video, going crossways across the fibers, okay? Can't really show you. But if you're going backwards and forwards across the fibers of the calf muscles to relieve the pressure. So you're finding those trigger points where it's sore and you're releasing those. So in other words, it's really important to have good foot and calf hygiene, if you like. These are your daily things that you do to repair the damage that you do when you're running and to release all the pressure and the knots and all that sort of thing, because they are what lead up to the Achilles problems. A couple of good exercises. So one, standing on a little step, doing some eccentric loading, which means when you're dropping the heel down, you're standing on the step, dropping the heel down and giving it a really good stretch, going down really slowly, so you're loading it all the way down, and then using your good leg or using your hands to push yourself back up, okay? So not loading the Achilles on the way up, but loading it on the way down, if that makes sense. So that's called eccentric loading, and that's a really, really good exercise to do. You want to be doing about 15 repetitions twice a day would be a good place to start for that. However, proviso, if you've got an actual rupture, don't do those yet, okay? If it's just tendonitis, that's a good place to start. What you might want to think about is, have you been on any medications that can cause weakness in your muscles and your tendons? There are a number of medications that will cause you to have to more likely to tear or rupture tendons. There's a number of antibiotics that do this, and some other medications that can have this detrimental effect, and we've seen this on people. We've had one person, for example, who had acne problems, and they were put on this medication, and all of a sudden they started ripping different tendons and ligaments. Not good things. So just make sure that you're not on anything like that that could be causing weakness. The same with a woman who've been pregnant recently. That can also mean that the hormones are making your body and your muscles more relaxed, and you're more likely to rip stuff. But those are the sort of outlying things. Another thing you can do is use a brace at night, which just holds the foot in a relaxed dorsiflexion. So it's not hanging down like that, but it's in a relaxed dorsiflexion if you want to get on top of it. Another thing is, don't walk around barefoot, even in your house. And don't walk around in high heels as well, ladies. So over shortening or over lengthening of the Achilles tendon can lead to major problems. So just to recap, mobility exercises, stretching, foam rolling of the actual foot and the calf muscles are really, really crucial when it comes to the Achilles. Gentle massaging of the Achilles if it's not ruptured. Doing that eccentric loading with that exercise on a step, but only downwards, not upwards. Doing that twice a day, 15 reps. Check your medication situation. If you're wanting to have anti-inflammatories, grab for turmeric is a good place to start rather than non-steroidal anti-inflammatories. If you heard a big crack when you had the injury, then you may have a complete rupture, and you really need that sorted out by doctors. Okay, make sure that you get to a doctor or a physio, etc. The other things that you can pull back on is, did you, in the time leading up to this injury, increase your mileage too much? Did you suddenly start running a lot of hills, because hill training puts a lot of pressure on your Achilles? Or did you do a whole lot of speed work in the build up to this injury? If any of those things are valid, then you might want to pull back on that type of training as you start to reintroduce running back into you. Start out with the slow, gentle stuff before you go into hills or speed work or upping the mileage too much. If you're having recurring problems and the first thing that you will notice when this is coming on is a stiffness in the Achilles joint that you are more likely to feel in the early hours of the morning when you first get up than later on in the day. So you might get up and it's a bit stiff and it's a bit sore. I've got that going on at the moment, and that's a warning sign to me to get over there and start getting the ball in there, start massaging my feet, start releasing the tension before it becomes a bigger problem. So as a general rule, maintain your flexibility and your mobility. This is something that's neglected by runners all around the world. We see it all the time, and people do not want to do their stretching and their mobility routines. But I tell you, if you want longevity in the sport, if you want to avoid injuries, then this is really crucial. So massage is another great way, mobilizing the joint. So there's a whole lot of good tips anyway for your Achilles problems. If you're wanting any more information, please get in touch with us. This is what we do. This is what we specialize in. Our run training philosophies is we don't believe in the old high mileage models, the traditional smash yourself to bits with huge mileage. That might work for a 20-year-old elite athlete, but not necessarily if you're older, or if you've got a full-time job and kids and careers and everything, and you're trying to pile on a whole lot of mileage. There's more efficient ways to train with less mileage, using strength workouts, mobility workouts, and quality run sessions that are really specific to the goals that you're going for. You can actually cut your mileage down and achieve better results. And I know this. I've done 25 years of extreme events, and I've worked with my partner Neil at Running Hot Coaching, who's an exercise scientist. And he actually revolutionized my career when 10 years ago I came to him pretty broken and burnt out and absolutely facing injury after injury. And he rebooted my body and changed the whole system. And since then, we have honed our skills and our systems so that we can get repeatable results for all of our athletes, no matter whether they're absolute beginners or really advanced elite ultramarathon runners running Death Valley and the likes. We have people right across the board doing all that sort of stuff. So I hope this has been of benefit to you today. And if you've got any more questions, please just let me know.